If you will direct your attention to figure B, we're going to start at the top left and watch the air as the air moves through the bird's respiratory system. It's going to be shaded like a pinkish red color. Anyway, what we're looking at first, inhaled air is red. So during inhalation, air is going to enter first into the posterior air sacs. Then it's going to enter the lungs. So here are the posterior air sacs. Now air is entering the lung. Now it's going to move from the lung to the anterior air sacs, which are located in all these areas here. And then air is going to exit through those anterior air sacs. So it goes one direction through the respiratory system. And again, that just allows for more efficient respiration compared to most vertebrates, most terrestrial vertebrates, is a tidal system where the air comes in and goes out the same pathway. All right. So modifications for breathing in humans. We're going to focus on the human respiratory system. Little fact here, normally adults have a breathing rate of 12 to 20 ventilations per minute. We call that breaths per minute, or BPMs, 12 to 20 BPMs. And the control of the ventilation rate, or the rhythm of ventilation, is done in the medulla oblongata, which also has cardiovascular centers for controlling heart rate. But the medulla oblongata and the pons, both of these are located in the brain stem. They work together to adjust the respiratory rate. The respiratory center is sensitive to hydrogen ion levels. So it is sensitive to pH, basically. When carbon dioxide enters the blood and reacts with water, it releases hydrogen, and that's how carbon dioxide lowers pH. So the higher the carbon dioxide level in the blood, the lower the pH is going to be, and the higher the hydrogen ion level is going to be. So high CO2 corresponds to high hydrogen, and that corresponds with low pH. There are chemoreceptors in the carotid and aortic bodies, in the carotid arteries and the aorta, that stimulate the respiratory center during intense exercise. But basically, that's what the respiratory center is sensitive to, is as carbon dioxide enters the blood, it lowers the pH, and those are the conditions that the respiratory center would cause the respiratory center to react. Let's see. The nerves involved in breathing are the ones that stimulate the intercostal muscles, the diaphragm and the intercostal muscles of the ribs. So the phrenic nerve actually stimulates the diaphragm to contract and relax. Well, it contracts, remember, by flattening out. But the nerves, the muscles that are used to inhale are the intercostal muscles and the diaphragm. And so they're stimulated by the intercostal nerves and the phrenic nerve. All right, for gas exchange and transport, ventilation or breathing causes the alveoli to have a higher partial pressure of oxygen and a lower partial pressure of carbon dioxide than the blood in the pulmonary capillaries, the capillaries that surround the alveoli. So the oxygen with the higher pressure in the alveoli is going to move into the blood. And then the carbon dioxide has a higher pressure in the blood. It's going to move into the alveoli. It's going to diffuse into the alveoli. So those partial pressures of those gases is what determines which direction they move. And then in the tissues, the opposite occurs. So the tissue cells are going to have a higher partial pressure of carbon dioxide. causing the carbon dioxide to move into the capillaries. Then the capillaries are going to have a higher partial pressure of oxygen, causing oxygen to move into the tissue cells. And you can see all of that illustrated here. So if we look at external respiration, the exchange of oxygen and carbon dioxide in the lungs, what you've got over here in the top left illustration is the connection between the alveolus or air sac of the lungs and the wall of the capillary, the blood capillary. So you have a higher partial pressure of oxygen. I guess you need to look over on the right. You have a higher partial pressure of oxygen in the alveolus because you've just breathed in air, which is high, has a higher partial pressure of oxygen than what you would have in the blood. So oxygen is going to move into the blood and it will attach, most of it will attach to hemoglobin on the red blood cell. There'll be a small percentage that's dissolved in the blood plasma. But oxygen diffuses across the respiratory membrane, which is formed between the wall of the alveolus and the wall of the blood vessel. It diffuses across into the blood because of the higher partial pressure in the alveolus. And the opposite's true with carbon dioxide. Carbon dioxide has a higher partial pressure in the blood, so it diffuses into the alveolus and we breathe it out. Now, for internal respiration in the tissue cells, our tissue cells are connected or close to anyway the walls of our blood vessels, of our capillaries, separated by interstitial fluid or tissue fluid, and the partial pressure of carbon dioxide is going to be higher in the tissues, so it's going to diffuse into the blood. But the partial pressure of oxygen is going to be higher in the blood, so it will diffuse into the tissue cells. All right, as far as transport of oxygen and carbon dioxide, most oxygen is transported through the blood as hemoglobin or attached to hemoglobin on the red blood cells. For carbon dioxide, and by the way, when hemoglobin has oxygen attached, we call it oxyhemoglobin. Carbon dioxide, there's a smaller percentage of carbon dioxide that also is transported attached to hemoglobin, and we call that carbaminohemoglobin. But most carbon dioxide is actually converted to bicarbonate ions through a chemical reaction. Most carbon dioxide is actually dissolved in the plasma as bicarbonate ions while it is transported through the blood. And this is that equation. So basically, carbon dioxide in water combines to form, let's look down here at the bottom. That shows this shows the reaction that forms the bicarbonate ion. So when carbon dioxide enters your blood plasma, which is 92% water, it forms carbonic acid and immediately it dissociates into hydrogen ions and bicarbonate ions. So the carbon dioxide actually is converted to bicarbonate and it travels through the blood in the plasma mostly as bicarbonate. But the other carbon dioxide, the rest of the carbon dioxide travels attached to hemoglobin. I'm assuming they don't show that one, but it's basically hemoglobin, instead of having oxygen attached, it has carbon dioxide attached. And here's what a hemoglobin molecule looks like. It has 4 globular units, and carbon dioxide attaches to the globular subunits. And then oxygen attaches to the heme group, and actually it attaches specifically to an iron atom, which is this purple molecule here. It attaches to an iron atom on a heme molecule. So you see that there are 4 of those iron atoms and 4 heme groups in a hemoglobin. So 4 oxygen molecules can attach and be transported by 1 hemoglobin protein. Now, section 3, which is our last section, is on respiratory disorders, respiratory diseases. just infections and that kind of thing. So we'll start with the common cold, which is a mild viral infection. In most people, it's mild, characterized by sneezing, runny nose, mild fever, and lasts a few days before the virus is eliminated by the immune system. Different viruses can cause the common cold. They're called coronaviruses, but I'm not talking about COVID here. But they're different forms of coronaviruses. That's just the type of virus that they are. And because there's so many different strains and they have such a high mutation rate, it's very difficult to make a vaccine for the common cold and make a vaccine that would be effective. Antibiotics are also ineffective for treating the common cold because antibiotics can only treat bacterial infections. They don't do anything for viral infections. Now, strep throat is acute pharyngitis or inflammation of the throat. Strep throat is caused by a bacterial infection of Streptococcus pyogenes. So it's a bacterial infection, meaning that you can treat it with antibiotics. The symptoms are going to be sore throat, high fever, and white patches on the tonsils. This is what severe strep throat looks like on someone's tonsils and in their the entrance to their throat. Disorders of the lower respiratory tract will start with choking, and you probably know that if someone chokes, the food goes down into the trachea. The Heimlich maneuver can dislodge that object and cause them to expel the object or cough it out. And you do the Heimlich maneuver by grabbing the choking person around their waist and forcefully pulling both hands into their upper abdomen. Then we're going to move on to acute bronchitis. This is an infection of the primary and secondary bronchi, which they're the main branches from the trachea. And it can be caused by an allergic reaction and environmental toxins or cigarette smoke. So this is just inflammation of the bronchi. Chronic bronchitis is when the airways become inflamed and filled with mucus, and it just lasts a lot longer. Smoking and exposure to airborne toxins, one that was many years ago that was found in, some buildings. What was the name of that thing? I just can't think right now. Asbestos. So asbestos could cause chronic exposure, could cause chronic bronchitis, probably some mold exposure, and people who work in the coal mines, can cause it. And then asthma is when the airways are unusually sensitive. This is more of an allergic type thing. But they're unusually sensitive to specific irritants, and when the person is exposed to these irritants, smooth muscles in the bronchioles undergo spasms, so it causes those bronchioles to constrict, and it makes breathing very difficult. So the person will wheeze and cough to try and breathe. Now, pneumonia is viral, bacterial, or fungal. It's an infection of the lungs in which the lungs filled with fluid and pus. Then you have tuberculosis, which is a bacterial infection caused by Mycobacterium tuberculosis. TB was a major killer in the United States before the middle of the 20th century. It causes lung damage, reduced function. Some areas of the world where HIV infection is common, they're seeing a rise in the incidence of tuberculosis. A tuberculosis skin test can determine if someone has been exposed to TB. All right, emphysema. And this is when the alveoli are distended and the walls are damaged, and this reduces the surface area available for gas exchange. It's going to make it very difficult for them to breathe. It contributes to COPD, which is chronic obstructive pulmonary disease. You see this in smokers, but it can also be people who don't, non-smokers can also have emphysema and chronic bronchitis, or emphysema and COPD. Non-smokers can have it too. And people who have lung cancer, whether they were smokers or not, typically develop chronic bronchitis and emphysema and COPD. Pulmonary fibrosis is when the fibrous connective tissue builds up in the lungs. Of course, that's going to restrict breathing. Lung cancer begins with the thickening and callousing of the cells lining the airways, and you start to see atypical cells in the lining. And cells from the tumor can break loose and metastasize, which means they spread to other tissues. But if the cancer originates in the lungs, you still call it lung cancer.